Now we're going to go into the special senses of hearing and equilibrium. With hearing, we're going to look at how hearing occurs through the external ear to the middle ear and the inner ear, and how that is going to be interpreted from the sound waves that enter those and then are transmitted to the brain. And then with equilibrium, we're going to look at the parts with the vestibule and the semicircular canals and how they actually play a very important role in knowing proprioception and balance. So hearing is also known as the auditory sense. It is a mechanical sense, and it is the conversion of sound waves in the air around you into a nervous impulse to the brain, with which then the brain actually interprets into what you hear as sound. When we look at all of our senses, it's important to remember that it is all interpretation of the world around us, and that no two animals or no two people actually hear the world the same way. It's all based on our interpretations. The main part of hearing structure in the ear is composed of three different areas and three different structures. We have the external ear, which is very important for collecting the sound waves and funneling them in. The middle ear, which is important in amplifying those sound waves. And then the inner ear, which is extremely important to converting sound waves into the nervous signal to the brain. If we have disease processes in any one of these areas, it can end up resulting in diminished hearing for the animal, to absence of hearing and deafness. So looking at the external ear, we have the pinna, which is the outer portion that we can see. It has got elastic cartilage inside of it with skin on the outside of it. In primates, our ears are pretty well fixed to the side of our head. We actually move our head more than we move our ears. When we hear sound, we are programmed and evolved to actually turn and look at the sound. But if we look at something like a horse actually will keep its head still a lot more and actually use its ear to hear what's going on around it instead of moving its head. From the pinna, it goes down into what's known as the external auditory canal. And with the external auditory canal, we have the vertical portion, which goes straight down and in. And then we have the horizontal portion, which actually goes down to the eardrum, or otherwise known as the tympanic membrane. In humans, this is more of a straight in, and in primates, but in dogs and horses and cats, it's actually more of this L shape. One thing to know is if we have something where there's like an infection, it's very easy for fluid to get built up, especially down here in this horizontal canal. And it can be a lot more difficult to try to treat ear infections down here in this horizontal canal than out here on the surface of the pinna, just because there's no natural drainage here. Everything has to try to move up and out. When we look specifically at the tympanic membrane, that is what's known as the eardrum, and it actually separates what the external ear is from the middle ear. The lateral surface is the external ear, and the medial surface of the tympanic membrane is the middle ear. It is extremely tightly stretched across the auditory canal, and it's actually going to vibrate, much like a snare drum would vibrate when it's struck. And this vibration is actually going to be transferred into the middle ear to a group of bones known as the osselettes. If the tympanic membrane is ruptured, it can lead to a loss of hearing for the animal. Ruptured eardrums are able to heal, and they can heal back. However, the scar and tissue in there definitely affects hearing in the future for the animal and can also lead to deafness. It is very important before we put any medications or do any type of treatment in the ear to make sure that the tympanic membrane is intact, because if it is damaged in any way and we put medications in there, then they could enter into the middle or inner ear and do serious damage to that animal. When we get to the middle ear is going to actually be inside the skull, and so there's actually what's known as the tympanic bulla, and we have the external acoustic meatus, which will be where the tympanic membrane sits at, and on the medial side of this is going to be the middle ear, and that's going to be in the bone, and the external ear is going to actually stop there, that tympanic membrane and that opening into the skull. The middle ear is filled with air, and it's very important to have that air because it ends up equalizing out pressure on both sides of the tympanic membrane to make sure it's not overpressurized on one side or the other. That would affect the way that the animal hears. And besides the tympanic membrane, the three main features within the middle ear are going to be the osselettes, which is the malleus, which actually attaches to the tympanic membrane. It's known as the hammer because of the way the bone is shaped. It looks like a mallet or a hammer. It attaches to the incus, and the incus looks like an anvil on the end, so people will call it the anvil. And then the incus hooks up to the stapes, which is known as the stirrup because it looks like a stirrup for a rider. And it's actually the stapes that hooks up to the cochlea or the inner ear where the sound waves will be transmitted and interpreted. So those osselettes go from the tympanic membrane. They will actually link over here to an area known as the vestibule and the cochlea of the inner ear. And they actually decrease the sound wave vibration in size, but they amplify them in force. So they make them to where they're much more forceful. And that's how they actually amplify the sound waves, to where when it enters the inner ear, when we get to it in a minute, it'll actually make these sound waves go into a fluid. So it increases the force to actually make this fluid in here vibrate. So the ocelots do act as levers that transmit the sound waves to the cochlea. So the malleus is the most outer bone. It's attached once again to the tympanic membrane. Incus is the middle bone, and it attaches to the malleus and to the stapes, and then the stapes actually goes to the oval window of the cochlea. And so those vibrations, once again, are decreased in size, but they're increased in force. Also important to know is there are muscles that attach to the malleus and the stapes that adjust to actually deaden extremely loud sounds before they arrive at the cochlea. And this can be important for really loud environments for animals. However, over time, in extremely noisy environments, these muscles and the way that they start to react on those bones can actually lead to, once again, hearing loss. Also hooked up to the middle ear is something called the eustachian tube, and the eustachian tube runs from the middle ear to the back of the pharynx, and its job is to equalize barometric pressure or air pressure between the tympanic membrane on the inside of the skull and the tympanic membrane in the external ear. If you have too much pressure on one side of the tympanic membrane, you will get bulging and will distort the sound. And too much pressure can actually lead to its rupture and damage. One thing to know is that there's a slit-like opening at the pharynx that's closed most of the time. However, when you yawn, swallow, or work your jaw, that opening opens up and actually allows the air pressure to adjust, which is why when we have a rapid change in altitude, like getting on a plane or driving up a mountain, our ears want to pop, and a lot of times we'll find ourselves working our jaws to allow that popping sensation to happen. So getting to the inner ear, we're going to look at the hearing side, and then we'll look over at the equilibrium side. So on the hearing side, what's really important to us is a structure called the cochlea. So the cochlea is the snail-like shaped bone inside of the inner ear, and it is spiral shaped on the inside. And in there is something called the organ of Corti, which is actually a fluid-filled portion of the inner ear, and it makes up the receptors of hearing. In here we can actually see the oval window where the sound comes in, cochlea in a spiral shape right here, and they're trying to show off part of the spiral right here where we have the membranes on the inside with the organ of Corti, and there's fluid that fills this area inside of here in the organ of Corti that actually the sound waves will be pushed into. And then there's actually these sound dampening fluids on either side of it too that we'll talk about here in a minute that actually sit there and help to dampen a little bit of the noise and the sound vibrations as they go through and to reduce and pull them away. And then the sound waves will exit from there out what's known as the round window. It's very important for those sound waves and that to be able to exit out, because if they don't, then they continuously stimulate the organ of Corti, and this can actually lead to something called tinnitus, or otherwise known as ringing of the ears. So when we look at the organ of Corti, it runs the length of the cochlea and the cochlear duct, so it goes all the way from the oval window around to the round window. So the oval window is what attaches to the stapes. It's going to bring in the sound waves. The round window is going to exit into the middle ear and allow the sound waves to dampen and leave the cochlea. Inside the cochlear duct, we have what's known as endolymph within the organ of Corti, and on either sides of that cochlear duct where the organ of Corti is, we have a fluid-filled area with what's known as perilymph. The organ of Corti has these special dendrites known as hearing receptor cells. They've got hairs on them. And so you can see these little microvilli here. Here's the actual hair cell itself, and then these are actually the nerve endings that attach to it, so little dendrites. And so as fluid in the duct, the sound waves actually sit there and cause this fluid to move back and forth. These little microvilli sense that movement back and forth, and they end up making a signal that's then turned to the nervous system and turned into a nerve impulse. We have these supporting cells that end up having the hairs on them that sense that movement there. And then we actually have what's known as the tectorial membrane, which has actually got the gel on it that's actually going to do the movement. So sound waves come in and they vibrate against the tympanic membrane, and then that signal is going to be sent across the middle ear through the ocelots. The ocelots are then going to attach to the oval window that's going to have the perilymph that's going to start the vibrations in the cochlear ducts and in the endolymph of the organ of Corti. And then the main thing to know here is in that cochlear duct where the organ of Corti is that tectorial membrane that's got the gel on it is going to sit there and rub up against those little hairs in the organ of Corti, and that rubbing sensation right there is what causes that stimulation on those hair cells, creates the nerve impulses that are then going to send to the brain and are going to be interpreted as the sounds you hear. High frequency sounds are going to be interpreted near the oval window, whereas low frequency sounds are actually interpreted more what we call the tip of the cochlea, or the more distal end from the oval window. So just a diagram again to show you the pathway here. Sound waves vibrate the tympanic membrane. This causes the malleus to sit there and actually vibrate. The malleus then causes the incus to actually vibrate, and there's actually a cartilaginous junction here. One thing that happens is over time the cartilage becomes less pliable, which actually results in hearing loss. And this is why at a certain age we start to lose hearing, and the same thing for animals. Then the incus is going to hook up to the stapes, and the same thing is going to happen here, a vibration. Once again, there's cartilage right here, and once again over time that can also degenerate to actually cause some hearing loss. But they're going to vibrate into each other, and this actually once again decreases amplitude but increases force, and that's going to actually enforce the perilymph to start to vibrate. And then that in turn is going to go here to the organ of corti and actually cause the sound waves to vibrate in here to the tectoral membrane in the endolymph. And then you have these hairs in the organ of corti that are going to sense that vibration of that tectoral membrane from the perilymph and the endolymph. Sound waves come through. Right here is where your high frequency sound would be at, the tip of the apex of the cochlea. This is where you're going to have your interpretation of your low frequency sounds. And then the sound waves are going to go out and eventually dissipate and go back out the round window. It's important to know if there's damage here once again to where the sound waves can't exit, then sound waves bounce back in here and then they keep stimulating, which causes that ringing sensation that can occur in the ear. That's the basic pathway for hearing there. So next we're going to look at equilibrium. So equilibrium is a mechanical sense too. It makes the animal be able to maintain balance and be able to stand upright and to move. It also helps in proprioception, knowing where the head's at, and helping the animal to know in relationship where the rest of the parts of the body would be at too. It allows the animal to know what type of movements are going on, whether it's sitting, walking, running, stretching, all of those different movements. The inner ear with equilibrium help the animal to determine what its movement is. So right next to the cochlea, we have a part of the inner ear known as the vestibule. And in the vestibule, we're going to have two distinct parts. We are going to have the saccule and we're going to have the utricle. Coming off the utricle are going to be specialized bone canals known as the semicircular canals. And together, all of these parts, the saccule, the utricle, and the semicircular canals, all play a key role in determining balance and equilibrium and proprioception. So looking close at the vestibule, we have two sac-like spaces, the utricle and the saccule. Both are filled with endolymph, and they're actually surrounded with perilymph too. In there we're going to have what's known as the macula. They're going to be found in both the utricle and the saccule. And they're going to have these hair-like extensions that come out. And in there is these little calcium crystals known as otoliths. And these otoliths move around in there, and they press on those hairs, allowing the body to take that signal of where they're pressing at and know the position of the head. If you're standing upright, if you're laying on your back, if you're laying on your stomach, if you're hanging upside down, because of where those otoliths are going to fall and land at on those hairs like dendrocytes. And so it's down to gravity. So you have these little calcium otoliths in here inside of this gelatinous matrix here. And so when you're standing up, they'll actually fall to the bottom of the macula. If you were hanging upside down, then these otoliths are going to fall up against the hairs that would be at the top of the macula. If you put your head forward, these are going to fall to the hairs at the front of the macula, whereas if you tilt your head back, these are going to fall towards the hair cells at the back of the macula. And so wherever these are landing at, they're going to hook up to these hair cells that are going to go to nerves that are going to then send that signal to the brain and say, this is where the position of the head is at. And then the head from there will figure out the generalized proprioception and balance of the body. Attached to this, we have the semicircular canals, and so these are important for looking at movement. So when we look at the saccule and the utricle, these are important for knowing the position of the head. The semicircular canal lets your body know when your head is moving and in which direction your head is moving. And so they come out of the vestibule, and they're also going to have fluid within them. And the inside of them, we have, at the very ends of them, we have an area known as the ampules. And in the ampules is a specific area known as the crista ampullaris, or just known as the crista or cristae. And in here is where the actual receptors are going to be at for movement of the head. Attached is going to be a special feature on top of here known as the cupula. This is a cone-shaped zone, and we're actually going to have the cells of the cristae actually protrude up into the cupula. And so as the head actually moves, there's going to be movement of the fluid in here that will stimulate these cells. So the cupula has got more endolymph in it, more of this really gelatinous thick fluid. And so as the body moves, these little hairs stick up in there, these sensory hairs, little dendrocyte-like projections stick up in there. And they end up sensing which way this gelatinous fluid is moving. And then based on that, the body decides which way if you're moving to the right, to the left, if you're running, walking, what you're doing is based on the movement inside of this cupula here. And then once again, just like we've seen with everything else, these hair cells in the inner ear are going to attach to a nerve, and that nerve is going to send an impulse telling the brain which way that you're actually moving based on which way those hairs are bent. When we look at the vestibule here and the semicircular canals, we can get diseases of balance that come in here. They can come from infections of the inner ear. They can also come with age and degeneration of these cells and degeneration of the endolymph. And it is something that we commonly see in older dogs. We will have owners that will report the dog will be doing things like circling in a certain direction. They'll have nystagmus in a certain direction. They'll have a head tilted that way. Most people think that their dog's had a stroke, but in reality, it's actually a disease process here within the vestibule and the semicircular canals. So that was an overview of hearing and equilibrium. Next, we will go into vision.